So surgically speaking, there are a couple of different approaches to labiaplasty. There is a more traditional approach, which essentially involves just trimming along the labia minora to make it match up better with the labia majora. But the drawbacks of that approach are, even though it is simple and a fast operation, it essentially leaves a scar right along the leading edge of the labia minora, which can be a different color than the surrounding tissue. It can be sometimes somewhat shiny or smooth and really doesn't match up with the remainder of the anatomy. And in that situation, it's really not an ideal operation. Several years ago, a better technique was devised, and there are definitely derivatives of each technique that have even come about since then. However, this technique that I have had very good success with and very high patient satisfaction is the wedge technique, which was first described by a surgeon by the name of Gary Alter. So with that approach, instead of just trimming along the edge of the labia minora, what you do is you actually excise a wedge of tissue from the labia minora. And generally speaking, you also track it up into the sulcus between the groove between the labia minora and the labia majora. And what that allows you to do is help to reduce the amount of volume of the labia, but also maintain a nice natural appearing edge, with the scar being hidden vertically oriented, or proximal to distally oriented, and then down into the sulcus here. And then on the internal aspect of it, the scar hides right along here. So I'm going to sort of demonstrate that in a moment.